In this short video, we will discuss the benefits of using HBOT to address injuries caused by radiation therapy. The FDA has approved HBOT for delayed radiation injury, which is often a progressive long-term complication of radiation therapy. Delayed radiation injuries occur months or even years after treatment. Radiation can cause damage to the endothelium of small blood vessels. The endothelium is the layer of single cells that is in the innermost part of the blood vessel. It plays a crucial role in maintaining vascular health and regulating blood flow. When radiation damages the endothelium, blood supply is reduced, which means that less oxygen is getting to tissues and bones, and this can lead to death of the tissues. HBOT increases oxygen supply to damaged tissues, which promotes healing. Also, HBOT acts by stimulating angiogenesis, which is the growth of new blood vessels. Further, HBOT also reduces chronic inflammation and edema. It increases collagen production and boosts the function of white blood cells. Also, HBOT is thought to protect healthy tissues against the harmful effects of radiation therapy. This is an important fact to know for those undergoing radiation therapy. Mouse studies found that when exposed to radiation, HBOT helps with the following benefits. It protects the jaw bones of mice. It enhances tissue growth and repair, improves blood vessel density, potentially reduces long-term damage. It reduces cognitive deficits and decreases neuronal cell death. A study by Chi et al. Found that HBOT, quote, as a first-line treatment for chronic bladder and urethral injuries following radiotherapy, demonstrates high efficacy, good safety, low cost, and high patient acceptance, unquote. This study included 23 patients. These patients received between 10 and 60 sessions of HBOT. The median number of dives that they received was 20. We call a session in a chamber a dive. The median time from symptom onset to initiation of HBOT was typically 3 months, but the range was anywhere from 1 to 15 months. I wonder if the delay in starting the treatment would affect the success rate for those patients that waited up to 15 months. The median follow-up period was 6 months. Of note, the follow-up period ranged from 1 to 21 months. I think that this is noteworthy because the patient may have needed more time to heal if the follow-up was done in only 1 month after the end of their HBOT dives. In this study, treatment outcomes showed that 43.5% of patients achieved complete remission, which is great, 47.8% achieved partial remission, which is awesome, and 8.7%, or 2 patients, did not respond to HBOT. Another study by Yang et al. Found that symptoms from radiation-induced hemorrhagic cystitis were found to be significantly improved. Cystitis is a type of bladder inflammation. Hemorrhagic cystitis is a person that's also having bleeding. In this systematic review, a total of 317 studies were searched and 14 articles with 556 patients were collected. The results showed that a total of 500 patients, or 89.9%, had symptom improvement, and the pooled results demonstrate that 55% of patients with HBOT had complete remission of blood in the urine. For more information on radiation-induced cystitis, please see the recent video that I did where the patients even had about an 87% success rate. There's a 10-year retrospective study looking at proctitis caused by injury from radiation therapy. Proctitis is inflammation of the inner lining of the rectum. In this study, they showed amazing before and after pictures of a patient's rectum that went from bleeding and injured to healthy after 60 HBOT sessions. On a related subject, I had a patient yesterday relay that he had undergone radiation therapy on his prostate some years ago. He said that he would notice a trace amount of blood in his urine at times, and after doing his dives in our office, he no longer notices the blood in the urine. So I hope that you can see there are a lot of positive reasons to do HBOT if you're dealing with the after effects of radiation therapy. If you have any questions, you can leave those in the comments section below. Also, if you have any suggestions for future topics, you can leave those in the comments section below. To learn more about our clinic, see our website listed in our description below. As always, it's been a pleasure to talk to you. I look forward to talking with you on our next video.